Good afternoon, everyone. So, today we will be discussing about oncology, symptoms, and supportive therapy. This presentation belongs to topic 6 Cancer Care Supportive Therapy. First of all, the supportive therapy we are focusing mainly on few things. So, let us start with this thing. A statement given by Hippocrates that let food be your medicine and medicine be your food. Actually, that indicates how important the food is. So, in supportive therapy, one of the main attractions or one of the main concern goes to food of the patient or the diet of the patient. Right. Before understanding the impact of nutrition on cancer, first important to understand the biochemical and physiological determinations of the disease. Cancers are a result of interaction of genetics, epigenetics and environment of the individual. Cancer is a chronic disease and you all know about cancers very well, right? Healthy cells. What is a healthy cell? Balance between growth and programmed cell death is tightly regulated. Such kind of cells we call healthy cells in case of in a normal living organism, right? Cancer cells are cells that grow and divide at an unregulated pace. So cancer cells, they have unregulated growth, unregulated division, and uncontrolled growth rate, and uncontrolled characteristics and function. So basically, what in case of what is a cancer, this we can take it as a definition for that, right? So symptoms of cancer, if you are, I'm not going to stress on this slide, because if you all cannot remember, you always can go back to the first lecture, that's about during introduction of the cancer, and during that presentation we discussed about these things thoroughly, right? So the cancer care supportive therapy. The cancer care supportive therapy includes of main main parts which are very much important in supportive of cancer patients. Let us look at one by one. First of all, we are concerning about nutritional care, or one of the very important points here. Then we have care for bone marrow suppression. Then there are some other diseases, mucositis, like that. Then psychological care of the patients. Then sexuality. Then patient education and palliative care. Right. So let's move on. Nutritional alterations in cancer. Here, pay attention to this picture. Chemotherapy, in many cases, it leads to side effects. Those are nausea, vomiting, mucositis, taste and smell alteration, anorexia. So these kind of side effects, and also GI malabsorption, and radiation therapy also causes GI malabsorption. So these kind of side effects leads to what? The less food intake. Less food intake leads to weight loss. That leads to malnutrition or cachexia. And at the same time, the increased catabolism rate also directly leads to weight loss, and that leads to malnutrition and cachexia. Right. Nutritional care. Nutritional problems arise due to the cancer itself and due to the therapies. First of all, we have anorexia, cachexia, immunocompetence, alimentary tract related defects, and age related effects. Nutritional consequences of cancer treatments may be due to the surgery, due to the radiotherapy, or due to a chemotherapy. In case of due to the surgery, changes in nutritional intake and absorption do happen. Then due to the radiotherapy, changes in due to the radiotherapy, stomatitis, xerostomia and dysphagia can develop. And due to chemotherapy, again stomatitis, anorexia and taste alterations can develop. right. So this is how normally this is a picture of a stomatitis. How does it looks like in a normal way? Then in a case of healthy tongue and a problematic tongue, how does it look like? That the problematic tongue, or when there's a side effect, that normally looks like a how a dry tongue, we say, right? That looks like a almost like a dry tongue, right? So what is this? This is cachexia. Now this is cachexia. What is cachexia? Cachexia is loss of skeletal muscle mass. Don't say just loss of weight or loss of muscle. No, loss of skeletal muscle mass. Now loss of weight, that is always reversible. We can reverse a loss of weight after giving food, but cachexia, that we cannot reverse just by giving food. So how to identify a patient who has undergone cachexia or who are cachectic? There are signs, and there are some signs. What are those signs? When you can see these intercostal recessions here, the intercostal muscles, when they have gone inside, or when they have recessions, then temporals, when they are inverted inside, and when there's dorsal guttering, in such cases or such signs, that suggests cachexia or cachectic type of a patient, right? So dorsal guttering, temporal wasting, and intercostal recessions mainly. And here most of the people, they say cachexia. When you say cachexia, that is wasting or wasting of muscles. Yes, that is true, but at the same time pay attention to the correct definition, which is the loss of skeletal muscle mass, right? Then anorexia. What is anorexia? That is diminished appetite or loss of appetite, we can say basically. An aversion to food, reversible if cause is eliminated. Patient may or may not appear thin. In anorexia, patient may be thin, may be not thin. In contrast to that, cachexia, that is ongoing loss of skeletal muscle mass here. This is the definition. And wasting with or without fat loss, caused by reduced food intake. Anorexia and abnormal metabolism, generally not reversible by feeding the patient, as we discussed. Then anorexia, again the loss of appetite. That could be toxic effects of therapy, like side effects of treatment such as nausea, sore mouth, stomach cramps, and taste change can also decrease the desire to eat. If the taste is not good, or if the taste has alterations, that may decrease the desire to eat. Then localized effects of the tumors in the GI tract that causes blockades also can decrease appetite. Now if, when there's a tumor in GI tract, that may decrease the appetite. Some tumors produce chemicals that affect the endocrine system, resulting in early satiety. What is early satiety? When you take a little amount of food, you feel that stomach is full. That is called early satiety. Very early you feel that you are full, right? Then early satiety may kill the appetite, making proper nutrition is difficult to achieve. Then anorexia could happen due to surgeries. Surgical removal of any part of the GI tract can decrease the ability and desire to eat, right? Now anorexia or loss of appetite, weight loss, sarcopenia, early satiety, taste changes, taste alterations, loss of appetite, then depression and anxiety, nausea and vomiting, pain, fatigue, all these things are side effects of could be side effects of cancer, and they lead eventually to cachexia, okay, or the loss of skeletal muscle mass, or in the basic words, yeah, okay, wasting or wastage, right? Then the second supportive therapy we needed, we were mentioning at the very beginning here, nutritional care, then bone marrow suppression, mucositis, psychological care, like that. We have to check for immunocompetence here. Immunocompetence is the ability of the body to produce a normal immune response following exposure to an antigen. Immunocompetence is the opposite of immunodeficiency, or immunocompetent or immunocompromised. Now the body should be able to produce a normal immune response following an exposure to an antigen, right? That is normal. Then we are concerning about alimentary tract or GI tract related effects. What are the signs here? Nausea could be, vomiting could be, diarrhea, gastritis, dehydration, mucositis, constipation could be, right? Let's move on with presentation. So, age related effects. Older patients will have special nutritional requirements that differ from patients at other stages of life. Of course, that's obviously. Nutritional consequences of cancer treatments that depend upon stage of cancer, location of cancer, and treatment modality. If depends on the treatment type, the radiation or whether chemotherapy or whether surgery, cancer patients may or may not be hypermetabolic. Maybe their metabolic rate is high, maybe their metabolic rate is normal. If the metabolic rate is high, that leads to weight loss. Yes, right. Location of cancer, especially if there's a cancer in GI tract, so we have to pay attention on nutritional consequences, right? Post-op nutritional problem. What are the main problems? Dumping syndrome, then feeling full after eating and drinking, then weight loss and malnutrition, then poor appetite, then indigestion and reflux, then diarrhea, then bilious vomiting, then calcium malabsorption, anemia, and narrowing of the joint between gull and small bowel after surgery. Diet therapy. It's a part of the stomach is removed. Very small frequent meals should be given at first. That very small frequent meals given if only a part of the stomach is removed. As the stomach will gradually stretch, larger amount can be given at a time. The stomach that stretches gradually. Patient may need to be given vitamin B12 supplement for the rest of the life to prevent anemia and nerve problems. And at the same time, for a while before after stomach surgery, the patient may need to have only liquid food. That is obvious, right? Nutritional therapy. How to give supportive care by nutrition. The main point is the enteral nutrition, as we know. Some people with stomach cancer are not able to eat or drink or enough to get enough nutrition. Stomach cancer or anything related with GI tract, especially in upper GI tract, in esophagus or stomach, those patients have difficulties in getting enough things to eat or drink to get enough nutrition. So a mine operation can be done to place a feeding tube through the skin of the abdomen and into the distal part of the stomach, known as a G tube, gastrostomy tube, or into the small intestine, known as J tube, jejunostomy tube, or liquid nutrition can then be put directly to the tube. Here, G tube, through skin directly to the distal part of the stomach. Then J tube directly to the jejunum. Then we have another types of also, the nasogastric, starting from nose and ending at gastric or gastrum or stomach. Then orogastric, starting from oral cavity and ending at stomach, right? Nausea and vomiting supportive care. Vomiting is stimulated by sensory receptors in stomach, including stretch receptors and chemoreceptors. Emetic center in the brain respond to these signals by causing a wave of reverse peristalsis. Now, in normal peristalsis, that it goes inside, but in reverse, that causes food particles or bolus to come out. Chemotherapy causes nausea by acting both on the brain and stomach. So chemotherapy, the main side effect of chemotherapy is being nauseated and feeling vomitish. Chemotherapy. Chemotherapy can result in following nutrition problems. What are those? Nausea, anorexia, vomiting, diarrhea, constipation, taste changes, mucositis, internal ulceration, and malabsorption. Multiple combinations of cytotoxic drugs can increase side effects. Sometimes we use 2 or 3 drugs, the combination of drugs for chemotherapy. So in such cases that increase the risk of having side effects or directly increase the side effects. Normal and malignant cells can be damaged in chemotherapy. Intake often decreases with each cycle of chemotherapy, and food aversion occur up to 74%, approximately 75% of the patient. In contrast to that, radiotherapy, nutritional problems may arise depending on area exposed, duration and total radiation dose, and especially in which area you are getting radiotherapy, like area exposed, the size and the area, the real area on breast or on other body part, like that. Radiotherapy can result in burning sensation to the throat, loss of appetite, taste alterations, sore mouth, dry mouth, damage or loss of teeth, abdominal cramping, nausea, fatigue, malabsorption or diarrhea. More than 10% of patients lose over 10% of their usual weight when radiotherapy continues for period of 6 to 8 weeks. Now here what is happening? They are losing their weight when the radiotherapy continues for 6 to 8 weeks. Right. Then bone marrow suppression. We have to concern about bone marrow suppression. Damage to bone marrow stem cells happen, and that shorter the circulating lifespan. So here in the case of normal bone marrow, you can see how the density, and in the case of bone marrow suppression, you can see how the density. So those become easily breakable. Signs and symptoms include bone pain, that often nocturnal. What is that? The night time. Bone pain happens in night time. Swelling and tenderness near the affected area. Then pathological fractures. Then fatigue, unintended weight loss, fever, and night sweating. Bone marrow suppression could be happen due to many reasons. Leukopenia. What is that? Any penia, neutropenia, leukopenia, that means low counts, or let's say neutrophilia, that means increased counts. So in case of leukopenia, or decrease of white blood cells, this kind of symptoms could happen, which leads to bone suppression. Fever, sore throat, cough, shortness of breath, chills, nasal congestion, and burning sensation, like that. Conditions like leukopenia, there are some other conditions as well: anemia, thrombocytopenia, and neutropenia. What is neutropenia again? The low count of neutrophils. Yes, so these things can lead to signs and symptoms and bone marrow suppression. So pay attention on that. I'm not going to read one by one. Right, then we have to pay attention on anemia. So what are the symptoms of anemia? Central nerve system symptoms are fatigue and dizziness and fainting. Here red color ones, or red color symptoms, occur in severe anemia. So in severe anemia, fainting occurs. Then blood vessels, low blood pressure, heart palpitations, rapid heart rate, chest pain, angina, and heart attack occurs in severe anemia. Then splenomegaly, then change stool colors, then muscular weakness, SOB, pale, cold, and jaundice skin, and yellow eyes, icteric eyes. Mucositis, as we told, let's see, we can call it as an ulceration. So there, what happens to control pain? Suck on ice chips or ice pops. Use pain medications as advised by your doctor. You can keep ice. Here the white patches and ulcers of the epithelium of the oral cavity, that is basically what mucositis is. Dietary modifications: eat moist or soft foods, avoid food that require a lot of chewing, avoid acidic, spicy, especially spicy, salty, and hot foods. Oral care: rinse mouth 5 to 6 times each day. Brush teeth with a soft toothbrush, not medium or a hard one. Oral mucositis refers to an inflammatory, erosive, and ulcerative process inside the mouth, which is usually caused by radiation or chemotherapy. Causes are causes for this mucositis, oral mucositis, is uh, there's one main cause, side effect, as a side effect of cancer treatment. Increased risks, or what are the risk factors? Those are smoking, alcohol, eating spicy food, dehydration, and dry mouth. And dry mouth is also occurred by chemotherapy and radiotherapy as well. Symptoms of oral mucositis include burning sensation while eating hot food, develop white patches or ulcers on lining of mouth, red and inflamed oral mucosa. Ulceration may cause severe pain, and the incubation, not incubation period, we can't call that, the normally, oral mucositis begin within 5 to 10 days after starting chemotherapy, or 14 days after starting radiotherapy. So mucositis appears between 5 to 10 days after starting chemotherapy, or else after 2 weeks of radiotherapy. Then there are some other conditions which looks alike oral mucositis. What are those? Candidiasis or oral thrush, herpes simplex virus HSV, and graft versus host disease GVHD. What are those which looks like oral mucositis? Candidiasis, herpes simplex, graft versus host disease. To diagnose oral mucositis, we have to examine mouth, then diagnose symptoms of pain, then checking ability to eat and drink properly. Complications include severe pain and trouble in eating, dry mouth, alterations in taste that leads to anorexia, weight loss, weakness due to poor nutrition, severe inflammation and injury to the oral mucosa, then reduction in dose of treatment. Treatments for this could be self-care, avoid tobacco, alcohol and hot and spicy foods, drink plenty of fluids, and palifermin is given by injection, which encourages the growth of new cells on the lining of mucous membrane. Again, what are the treatment options? Self-care, avoid tobacco, alcohol and hot and spicy food, drink plenty of fluids, and palifermin injection. How to investigate oral mucositis? That we discussed here: the diagnosis, the investigation, and complications and treatment. Then we have to pay attention on psychological care. Psychological problems include fear, anxiety, depression, and lack of control over self. The nursing interventions include providing information about the therapies and the potential physical side effects. First of all, in the psychological care, you should provide true information about therapy and potential side effects. Then provide information about treatment for depression, stress, or other mental emotional conditions that we can discuss with the patient party. So we have to build a good rapport with patient party, of course. Provide or suggest ways to assist them with daily activities, then they can no longer perform independently. Now here, what is that? Suggest ways to assist them with daily activities. If they are engaged in daily activities, they won't be having any time to perform independently. Yes, so we can make them busy with such daily activities. Provide or suggest ways to assist patient with transportation, prosthetics, medication, and other supplies they cannot afford or to which they do not have access. Then the next supportive care should be on sexuality. Especially on a previous lecture also we talked about that. Let's look into this thing superficially. Nursing intervention for the problem related to sexuality. Inform patient on the side effect of any treatment plan, and that may cause sexual discomfort. For an example, chemotherapy can cause changes in sexual response and fertility or libido. At the same time, patients with gynecological cancer and those who need to undergo brachytherapy should educate on exercise after surgery, as this may cause constriction to vagina. Educate patients about dryness occurs after gynecological surgeries and teach them to use lubricants in case of sexual intercourse. Yes, then educate patients with ostomies not to consume gas producing food. Now, patients who are with colostomy or ostomy bags, we have to inform them not to consume gas producing food. Ask patient to clean ostomy bag before performing sexual activities. Yes, in last lecture also we discussed that before going near to your partner, you have to do what? You have to clear your colostomy bag in such case, and also use some nice deodorant. Then in case of a breast mastectomy or removal of breast, how to cope up with the sexual life and the sexual intercourse, and how to lead a good family life, how to educate the husband, and those things we discussed on previous lecture as well. As nurses, we should be able to perform such tasks. Then the palliative care. In a previous lecture we discussed that palliative care is aimed to decrease the signs and symptoms, or to decrease pain, and basically to decrease disease, like we are controlling the disease as much as possible, right? WHO definition of palliative care, let's look on to that. Palliative care is an approach that improves the quality of life of patient and their families facing the problem associated with life-threatening illness, through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial and spiritual. Here what you have to remember is approach that improves the quality of life and their families associated with life-threatening illnesses. Aim of palliative care: to help the patients to maintain best possible level of physical, emotional, spiritual and social life during their remaining time. Help the patient to maintain best possible level. Or aim is to make them to take to make the quality of life, to give them a better quality of life um, in a best possible way. Okay, in a best possible way. Yes, right. Then palliative care also includes relief from pain and other distressing symptoms, like we are aiming on relieving of from pain and other distressing symptoms. Life and dying as normal process, like we affirm to the patient that life and dying as a normal process. Then intends neither to hasten or postpone death. Then integrates the psychological and spiritual aspects of patient care, and offer a support system to help patients and help patients until their death, and help the family to cope during patient illness and all. So these are the palliative care focuses, or palliative care concerns. At last they all concern on to improve or enhance the quality of life of the patient, right? So ethical considerations. What are the ethical considerations involved in palliative care? The beneficiary, the non-malfeasance, then autonomy, then fidelity, then justice and veracity. You can refer to these wordings, and I think that's pretty much with this presentation. Classification of cancer, there are breast cancer, uterine cancer, cervical cancer, ovarian and many types of cancers. And yeah, that's pretty much with this presentation. And you all, if you have any questions from this lecture or any other lecture, you all can always reach us through WhatsApp, Viber or email. You can send your questions. We will answer them. We will be more than happy to answer them. And at the same time, we want you all to stay at home, may be busy with your duties, but whenever possible stay at home and stay safe during this outbreak season. And we wish to see you all soon at IIHS, and you can bring your questions there as well. We will be discussing these things. If you have any problematic, or if you have any confusion regarding lectures or presentations, we hope to discuss them when we meet physically as well, right? Again, thank you very much for your time. If you have any questions regarding this presentation or any other presentation, you can always reach us through Viber, WhatsApp, email, and call or message or any other mean, right? Thank you very much for your time. Thank you.